So I'm going to start with talking about defining the problem kind of within artificial intelligence. And I think, to me, this is kind of near and dear to my heart because I think we've done this poorly over the last 10 years, and I'm as guilty as other people are of not really thinking really deeply about where to apply artificial intelligence and how to do that application and what problems to kind of solve in this space. These are just my disclosures. I mean, all of you are in the room one way or the other because I think you have a general interest in artificial intelligence. This is kind of the quintuple aim now of population health and patient experience and reducing costs and equity and inclusion and care team well-being. So, I think to some degree people are looking at it as AI as kind of trying to solve all of these issues. And it has promise in all of these areas, but we'll kind of talk about it a little bit afterwards. I think there are some limitations, and we should think about those things. I think naturally the question becomes, why focus on the problem? Hopefully we're in the business of defining problems and finding solutions to things. But one thing that AI in medicine, at least, and I think in other areas to some degree has suffered from is this kind of gap. There's been a lot of hype around AI for many years in medicine. But if you look, and I would challenge people to go out tonight, between going to the bars and other things, to just Google, outcomes or outcome improvement associated with AI in medicine. And if you do that, because I've done it on several occasions, it's very difficult to find clear papers where there are clear outcome differences with the application of AI. There are a few, but there's not a ton. And the question is, why? Why are we seeing this where we're not seeing huge outcome differences or changes? And I think some of this is about how we've approached the problem and how it's kind of developed within kind of the medicine space. And so I'm going to cover three different areas. One is kind of up until now, we've had this issue of it was cool, issues of data availability and being disconnected from the care team. So I'll give you this as a kind of a personal experience. This is kind of how even I got started a little bit. Is like, wouldn't it be cool if we did this? So 5, 6, 8 years ago, you started having a lot of AI algorithms that were coming out that were better than standard kind of logistic regression and other methods for being able to do some type of predictive task or other things. And so I think people at the time were like, oh, well, wouldn't it be cool if we showed that with this AI algorithm that from a predictive performance standpoint we can outperform logistic regression. And so probably for like several years, all you had was like tons and tons of papers coming out. They did nothing in practice. They took some observational data set. They said, oh, we can predict this outcome, and we can do it better than standard logistic regression, and that was it. And that happened it's still going on. But I think that's kind of what the start was. And so right from the beginning, you can see that there was this lack of kind of focus on the problems that, trying to be solved. The other issue is that kind of an issue around data availability. So you had this disconnect where you have lots of data scientists that are coming from other spaces, from industry, et cetera, but they don't have access, like direct access to medical data. They're working off either some open source observational data like Mimic. If you have heard of Mimic, it's an ICU database that's open source and de-identified. But there was not this kind of direct connection into healthcare systems and the data that they have there. And so obviously you can't really solve a problem that's directly related to a particular healthcare institution if you don't have data that's available. And then I think third, and kind of connecting with the other two, is there was this disconnect from the care team. So again, you had teams of people that knew AI, knew those types of things, knew what to do with data science applications, but there was no connection with an actual care team. You didn't have care teams that were incorporating data scientists and AI people into their teams to be able to solve healthcare problems. And so I think hopefully what you'll see kind of throughout the day today is kind of this idea of kind of retooling that and thinking about how do we actually solve problems kind of within the healthcare space using AI. And I think the kind of area to start with is to ask the question, what is AI actually good for And so I broke this up into 3, and this is more of my kind of opinion about kind of the advantages, disadvantages, and kind of neutral ground areas of AI. But I'll walk through them briefly just to kind of point out some things. So from the standpoint of advantages, this kind of issue of automation, scale, and noise reduction, AI does a great job of this, all of these things. So you can run an algorithm all the time. It's never going to hopefully fail unless your system fails in some way. But it has no problem running through tens of thousands of reports or something like that. And that also goes to scale because you can run these things continuously during that time. And then AI does the same thing over and over. So there's this concept of noise reduction. Like you feed in the data, it's going to make the same decision based on that data every time. That's very different than physician practices and other things. From a disadvantages standpoint, I think we have issues around trustworthiness and data availability and adaptability in this space. And those are still things we have to contend with. And then there's this neutral ground area, which I think is like, does AI actually improve operational efficiencies? Does it change cost structures? Does it actually improve accuracy of things? And these are questions you need to ask when you're approaching the problem. Because I'm not convinced that, from a diagnosis standpoint that let's take an example of like somebody coming in with chest pain. I'm not convinced that we'll ever have a system or that is going to be as good as a physician standing there in front of a patient, acquiring data in real time to make a real time decision. I mean, I guess if we start to record the room and we incorporate all kinds of other things, but there's this issue of data availability and other things that I think that margin is pretty slim. So recognizing those kind of advantages, disadvantages, I'm going to take you through kind of a different approach to looking at AI problems. And this is kind of around design-oriented thinking. And this will kind of integrate also, I think, with some of the implementation stuff you'll see in the future. So we're going to kind of cover 5 different areas in kind of design-oriented thinking. So empathize and defining the issues, thinking about the problems, prototyping and testing, and I'm just going to kind of walk through a little bit about this. So the first thing about looking at these problems is really understanding what are like the actual user needs. And this is where that disconnect happened in the past with kind of the AI applications and artificial intelligence and people, data scientists doing stuff on observational data sets. Is that they weren't connected to the users. They were kind of making up these problems on their own. And so really kind of getting into those user needs is a key component of that. And so there are definitely different ways to go about this. One thing is doing process mapping, another semi-structured interviews. But the idea is to really understand kind of what is the underlying issue. And you may find that it's an issue with some nursing communication between 2 people or something else, and it has nothing to do with AI at the end of things. And so, I think this is an initial step that you're going to have to kind of walk through. And then after that, it's clearly defining the problem. Is it something that we can actually solve through AI? And what is the problem that we're actually trying to solve? So are we trying to better predict a particular diagnosis? Are we trying to change a particular outcome? And asking stakeholders and moving through that process is key. And there are different questions you can ask about what is known, what's not known. I tend to view this as very similar to like approaching a kind of a math problem, and you're thinking about what problems have I seen in the past that have similarities to this. What information can I bring to bear on those types of questions? And there are all kinds of things within that problem kind of thinking that you need to also consider. So is it a high-risk kind of recommendation? So am I making a recommendation about cancer treatment? That's obviously going to have a different context than a simple recommendation about some type of follow-up. What are the data inputs and needs? And we'll talk a little bit more about that in the future as well. So there's lots of questions you should kind of ask in this, and I think as you hear through the lectures, you'll kind of get a better sense of those types of questions to ask. And then I think this is a step that we often, I think, overlook, which is just generating ideas about how to solve that problem. And it doesn't necessarily have to involve AI. It can, and you can definitely bring that as a tool kind of in your toolbox. But we should think about other things, their educational steps, their feedback audit and feedback components. Is there, do we just need to present the data in a different way that doesn't necessarily have AI as a component? And then taking those ideas and prototyping, we'll go through kind of a little bit of that later on, is a big point of this. And I'll give you just a brief history on one of the kind of issues we had with prototyping. I thought it would be this great idea if we asked people, what their prior probability of a urinary tract infection was. And I quickly realized that asking people what their prior probabilities or what they were thinking about from a standpoint of kind of a probability around a diagnosis was probably a bad idea because people didn't have any real conception of that. So you don't really encounter those types of things until you run through some of these prototyping steps. And then lastly, as a component of that, there's this kind of continuous iterative kind of refinement and testing and further kind of defining the problem through this. So you may do some testing. You may realize, well, actually, what we thought was the right kind of care process needs to be tweaked, and we may need to kind of redefine the problem within this space. So, I think in closing from this point, I think the main thing is to take a very holistic kind of viewpoint on problem solving within healthcare and thinking AI is not the solution, but a potential kind of tool within the toolbox that you can use. So I'm going to stop there and transition over, and then we'll hold any questions or anything else till we have kind of the breakout sessions, and then we can kind of move forward after that.